Every 5-cent fare increase is a large chunk of my income. It's $36.50, figuring a dime a day. That is $109.50 in the past 3 years, but I have not had any raise in my income. So for me, this is not about fun and games. This is about my life. I use TriMet to take care of everything. When I use a transfer, my life opportunities are limited. I know I will have to pay twice to go search for a job or to meet friends for fun, and sometimes I don't because I simply can't afford it. And who knows what else I might be able to do if only I had a bit more time. There are many benefits to the campaign for a fair transfer. I know that those of us who depend on the transit the most will be incredibly grateful and appreciative. And I do want to thank you for listening. Thank you very much.
Good morning, TriMet Board. My name is Marisa Espinosa, and I am a bus rider. I ride the 75, 72, 73, and the MAX. I don't own a car, and I have a long-term illness, so I rely on TriMet to get me to work, the doctor, pharmacy, and grocery store when I'm too sick to ride my bike. I use single-ticket transfers because monthly passes have become too expensive for me, especially as my health care costs have increased. I want to talk today about accountability. I face many obstacles in being able to reliably get on the bus and arrive at my destination on time. Service cuts have made buses overcrowded, with longer wait times and insufficient transfer times. Even facing these challenges, I value my experiences as a bus rider, and I want to see the system function the best that it can. But just as an individual can't do that alone, TriMet as an agency can't do that alone. That's where community partnerships and accountability comes in. TriMet is an institution that makes many decisions that affect different people differently, and TriMet needs to be open to hearing the perspectives of transit riders and responding to those needs. By standing here before you right now, the transit rider community is holding TriMet accountable for its transfer policy. For folks like myself living and working close in, I can usually get to a single destination, to work or to my nurse practitioner or the pharmacy, in time without my transfer expiring. I know I'm lucky to be able to get to a single point in the TriMet system with no other stops in between, but if you try to add another stop in or a trip back to work or back home, the reliability breaks down. This is where I can tell you about when I needed to use my transfer to get to work after a medical appointment, but the next bus was overcrowded and passed me by and my transfer expired. Or the time I was really sick and needed to get to an emergency medical appointment past Clackamas Town Center, but my transfer expired while waiting for a bus for the transit center across 205, and I was forced to walk the last few miles to get to my doctor. Or the countless other times that the transfer time is not worth for me. I can tell you those stories, but this is about the dozens of bus riders I personally talked to about the campaign for a fair transfer, and the 6,000 transit riders who have signed our petition. You don't need to know every story of every reason why it hasn't worked. You need to hear us when we tell you that the transfer policy does not give us enough time, plain and simple. We are here today to deliver this message, but also to say that we want to work with you to make this policy and your system better meet the needs of those who rely on it the most. We are here to hold you accountable. Your job is to show us that you hear us and that you understand. Thank you for listening.
May I say something?
Are you in the group that...
Yes, I'm here with the crew. My name is Alfred King. I used to drive the bus for Rose City Transit back in 1968. Thank you, ma'am. Also, I would like to say that bus number 6, how you doing? How are you? Bus number 6 does not have enough buses for the people on bus number 6. I catch a bus several times a day going west, east, south, and it's packed. It's standing room only for the elders that ride that bus. I know I look good, but back in 1968 for Rose City Transit, I was there, and I Yeah.
We're thank you for the coordinated testimony from Opal, but I appreciate it.
All right.
Welcome.
Thank you. Board members, my name is Alan Ippolito. I work for Verde. We're a nonprofit tax-exempt organization. We serve communities by building environmental wealth through social enterprise outreach and advocacy. I want to express our unreserved, unqualified, enthusiastic support for the campaign for a fair transfer, including Opal's request for a motion and resolution at your hearing today. I would note that over the last couple of years, several significant equity gains have been made in sustainability in that manner. Resolutions were introduced at the Portland City Council when Clean Energy Works Portland, a pilot for weatherizing homes with on-bill financing, was advanced. That program had an innovative community workforce agreement for local hiring and contracting and job training and such. And there were some significant amendments made by City Council at that first hearing based on suggestions from equity advocates who participated in the development of that workforce agreement. And I would note that last summer, the Portland Development Commission changed its resolution by which it funded schematic design for the Oregon Sustainability Center to include equity language for schematic design. And again, that was based on suggestions by equity stakeholders. So we've been able to do a lot of the work at the last minute, so I just want to strongly suggest that you take that very seriously. So you've heard a lot about the harms that exist, the benefits that can be had. Opal and its partners, we're working on a very mainstream notion called environmental justice, which is that everybody deserves their fair share of environmental benefits, including access to transit. Nobody should bear inequitable harms or more than their share of burdens of these environmental decisions. And I want to point out that what's being asked of your agency is right in your wheelhouse, right? No one here is asking you to do something that you can't do. Setting transit policy, setting transfer times, that's what you do, right? We're not asking you to create a new area of policy, create a new division to meet some need that couldn't be anticipated. But the second part is the access to decision making, and this is something that I really want you to seriously consider. And that's, I think, what this hearing and conversation presentation today presents a serious question moving forward for your agency in terms of particularly this constituency that it serves, the transit dependent. So how did we get to a circumstance, how did the agency and the community get to a circumstance where you have a community-based organization serving transit-dependent communities, needing to raise funds from 3 different foundations, collect 6,000 signatures, enlist 30 partner organizations, and devote thousands of volunteer and staff hours to get in front of you today to tell this story? Right? It shouldn't be that hard. Right? These are investments that we need to be making. I want you to consider moving forward what's going on with your public engagement policies and practices around transit dependent. That kind of investment from that community is necessary to get this information in front of you today. Thank you.
Hey. Yeah, my transfer is going to expire. I better get out of here.
Start again. All right, I will do that. Good morning, everyone. My name is Sidi Dubai. I'm a community organizer for the African Women Coalition. Our organization has endorsed this campaign because many of our community members depend on TriMet. Many of whom do not know how to drive, and many are struggling to afford the rising costs of fares and are forced to use single tickets. We're a community of immigrants and refugees who come together regularly, and we experience many of our riders who cannot come together due to the poor transfer policy. As a bus rider for 10 years, I know firsthand how the current transfer policy is not enough. I live in Montego and work part-time near the Rose Garden. When I buy a single ticket and ride the 44 downtown, sometimes my transfer expires before I catch the 9 connection. I end up paying twice a day just to get to work. Now I usually just buy a 5-day, all-day ticket just to be safe. I am from Somalia and I depend on the bus as a primary means of transportation, so do many of us. We often have to think about how much it will cost us to go out and do errands because we know we will have to pay twice, once to get there and once to get back. Please do not put us in this predicament of having to decide between saving a couple of dollars versus canceling doctor appointments for ourselves or children. Please support this campaign to create a fair transfer for all bus riders so we use the system to meet our basic needs.
My name is Tyler. I'm working in Seafield, but bus ride supporter. That's it.
Thank you.
Good morning, members of the TriMet board. My name is Michael Moore, and I'm on the board of directors at Sisters of the Road. Sisters joined with Opal, supporting Opal's campaign for a fair transfer, because we recognize how important this issue is to our customers, many of whom are living in poverty or experiencing homelessness. Most are dependent upon single fares for transit, the price of monthly or yearly passes being well beyond reach. A single one-way, two-zone adult fare is now 60 cents more than a nutritious meal and beverage at our cafe. With the current transfer policy, the cost of a round trip puts lunch, even at the least expensive cafe in Portland, out of reach for some of our customers. Another reason we enthusiastically support Opal's work is because Opal gives marginalized communities a voice in our regional transportation system. Several of TriMet's board members have stated the need for greater transparency and more opportunities for community input into TriMet's decision-making. Mr. Van Beveren was quoted in the Oregonian last year, noting that the best input into service cuts came from public comments. Opal has met with most of you over the past months to explain the campaign goals, to relate the struggles of transit-dependent population it represents, some of whose stories you're hearing this morning, and seek your comments about potential concerns TriMet might have implementing the policy changes Opal recommends. I had the pleasure of attending one such meeting with Dr. Bethel. It seems, however, that there is a disconnect between board members' desires for more community input and processes in place for TriMet to actually do something meaningful with that input. We were disappointed to hear that months of petition gathering, community organizing, volunteer efforts, and meetings with agency staffers and board members were initially dismissed with an inadequate cost-benefit analysis from TriMet that rested on flawed assumptions. Opal's experiences have left us with the impression that you are governing an organization that has not yet figured out how to work with communities with which it isn't already comfortable. Opal's resolution to study the costs and benefits of Opal's policy proposals in a more thorough and a more equitable way provides you with an opportunity to begin correcting that impression. We urge you to take that step this morning by adopting Opal's resolution, and we thank you for the opportunity to do so.